legislature by March of next year on recommendations to make the suing the prescriber so much easier.
Well, yeah,
Good.
the whole deal is they're trying to figure out a way to do away with the act, but let me hang on a second. I'll see what I can find while we're waiting.
Sure.
Alexa, turn on study.
Okay.
All right, Tracy, you should be getting it.
Okay, just waiting on it to come through. Okay, I have it published. Let me go check just to make sure it is working. Okay, y'all good to go.
All right, so the meeting of the Medical Psychology Advisory Committee meeting is called to order on June the 12th, 2026. Present, Warren Lowe,
Darla Burnett.
Rob Dames.
Glenn Alley.
all right, we have a quorum. I presume the agenda meets the criteria. Do we have any public comments, Dr. Van?
None at this time.
All right, thank you. So on the agenda today, we have some items that are probably kind of brief, only involve some brief discussion, but there have been a lot of issues with CE Broker this year. Lots of problems that people are running into. Ms. Burton in licensing has been very helpful to a number of the medical psychologists that run into problems. One of the problems that is non-intuitive is that CE Broker has listed the LAMP CME under the general category of CE. So people are looking for LAMP CME under the CME UBRIC, and it's not there, and they're putting in their LAMP CME in that category because they obviously think that's where it belongs, but their license is not getting approved because it's not going into the specific LAMP CME block. And so I think we've gotten that straightened out. Not that they've moved it to the correct category, but that people now know that they need to go under CE to find LAMP CME. The other thing that's happening is that some people are getting turned down because they aren't listing their basic life support because it's a 2-year approval, and they may have listed it last year and don't think they need to list it again, but they're getting turned down because it's not listed. So I think we've learned that, and this is the first time that issue's ever come up. So we're always a little surprised by some of the idiosyncrasies of CE Broker, but I think we're working through most of them now. Any comments about that? Have any of you completed your renewal yet? I have not.
Yeah, I completed mine, and it's pretty much a little bit of trial and error. I do use the paid version, The support there has been kind of sketchy, even with the paid version. But everything you mentioned is something that I dealt with and was able to problem solve around it.
Yeah, that's another complaint that I've heard is that there's not a lot of technical support, and some people have been told apparently that they don't get technical support unless they buy the purchase the paid version, and even under the paid version, support is not readily available.
We have met with CE Broker about that. Under our contract, they're supposed to give us support. They're fixing that. And one of the things we're doing, Warren, is since we got the new license class, we're going to be operating under 2 separate licenses so that the people that don't have the advanced license will have one set of criteria in CE Broker, and the ones that have the advanced will have another. So I think that'll eliminate a lot of the problems, but we never know, and we always appreciate the feedback. And CE Broker usually fixes these things when we talk to them. The biggest recurrent problem is their tech support people have not, how do I want to say this? They turn them over a lot, and they're not all trained to understand that Louisiana is one of the earliest adopter of CE Broker, is under contract for even our non-paid people to get tech support. And that's when we're having the biggest problem. Every time they turn over somebody, they just don't seem to get them all fully trained on that concept.
Yeah. Well, we have the most convoluted CE requirements of anyone, I think, and that's part of the problem. But I'm hoping that the simplified licenses next year will make a difference.
Me too.
Yeah.
Warren, should we write up exactly how the LAMP required CME should be listed in CE Broker, so when they are making those changes, they can put it in the right place?
Well, actually, both of y'all should be able to get it. The question is, what do you want to label it? And I think that's more important. But if you tell us what you want to label it, we'll label it anything you want.
Well, I'm almost hesitant to change it at this point because people have learned now where they need to go to find it. I mean, intuitively, it should go under CME and not CE because it is CME. But I think everybody now has figured out where it is, and if we change it now, we'll create a whole new set of problems. So hopefully next year we can, with the simplification of the licenses, that'll take care of a lot of this.
Yeah, my suggestion would be wait until the new licensing format, then let's see what's going on, and then we can give them some specific feedback if it's not fixed.
I agree.
Yeah. Yeah.
Will do. Thank you for the suggestion.
Yeah, and kudos to Ms. Burton because she has been very, very helpful. Okay, next on the agenda, I was contacted by 2 people who let their licenses expire. And it wasn't for any particular reason like illness, significant change in circumstance, anything like that. They just decided that they didn't want to hold the license any longer. They were both in other states. And now they've decided that they do want to get licensed. It's been over 2 years. The way I read the law, if it's been over 2 years, it's like you're starting from scratch.
Yes, sir.
You have to go back and get licensed by LSBEP.
And their rules also say you're starting from scratch after 2 years.
Yeah, it will require a retaking of the PEP, as I read the law. So basically, it's a big deal if you let it go 2 years or more. One of the licensees said he didn't mind starting over from scratch. The other said he wasn't having any part of it. So I just want to be sure that I'm on track about that and reading it correctly. I
My
talked to Matt,
interpretation of the law is the same unless Ms. Wilton has a different one. I'm in agreement with you.
Yeah,
agree. I agree.
I also agree. Yeah.
okay, all right. Okay, so, and I'll pass that on to the two people that contacted me. So, the two particular pieces of legislation that took place during this recent legislative session was our licensing change from a certificate of advanced practice to a license in the advanced practice of medical psychology. That was House Bill 747, sponsored by Dustin Miller, who's the chair of the House Health and Welfare Committee. The bill passed without any opposition at any point where there was a vote, and was signed by the governor on May the 15th. Became Act 174 of the legislature, and that will go into effect on August the 1st. So during our next renewal period in August of 2027, we will be renewing either a license for medical psychology or a license for the advanced practice of medical psychology. The other bill was House Bill 486 by Annie Spell, and that was signed by the governor on May 22nd, Act 302, if I'm remembering correctly, of the legislature. That will go into effect on January the 1st of 2028. The Board of Medical Examiners of Psychologists asked that they be given extra time to prepare for this because they think it's going to take a lot of preparation. People I've talked to said it takes little or no preparation because all of it's handled by the PAC. But at any rate, that's where that stands. Those were the two bills, and of course, the second bill only affects medical psychologists who hold a license with LSBEP and are a member of SIPAC. You cannot be a member of SIPAC unless you're licensed by LSBEP. This does not in any way pertain to prescribing of medications. It was not intended to do that, and certainly does not do that. It only covers what is referred to in the bill as telepsychology. Okay, any questions about that? Okay, next item on the agenda is the Healthcare Professionals Foundation of Louisiana. And I put that on there because I just wanted to learn a little bit more about the board's relationship with HPFL. So, Van, you can help me out.
Okay.
Does any complaint against a healthcare provider licensed by LSBME, is that complaint referred to the foundation if there's a question of possible mental difficulties, physical difficulties, addiction difficulties? Does that automatically go to the foundation?
Not necessarily. Okay, so I think what we have to understand is that the foundation is designed to provide evaluation services and recommend treatment services and monitor treatment services. And they can design those treatment services to be a combination of inpatient, long-term follow-up care and things like that. People can get in there confidentially and privately so that if someone has a problem or thinks they have a problem with substance abuse, they can call up, get directly into the program with substance abuse, And then we as a board do not find out anything about it unless they fail to follow the treatment plan and the recommendations of the HPFL. So it's a confidential system at that point. It has been extraordinarily successful because they're able to continue to work, to get their treatment and do what they need to do. And when you compare it to other high professional groups where they isolate them, like pilots, for example, we have these programs nationwide for healthcare providers in this confidential arena have a very high success rate with a very low recidivism rate. Now, the other situation is we get a complaint and we then recommend that that person go. That's a different story. That could be part of the recommended therapy or treatment or discipline. And then if they go to that program and they're monitored and then they fall out, then they come back to us. But that's a matter of the board getting a complaint. And again, it does not address things like billing issues, fraud. It doesn't address boundary violations and things like that. It really is designed for substance abuse. And I think the bigger issue is it was originally designed for disabled people and that kind of stuff for evaluation, but that has never really continued in the way the program runs. It's really designed more than anything else to monitor physicians in this time of stress in the life of physicians when they get involved in abuse of substances, and then they get recognized either through an intervention with their family or at their medical staff, and they report directly to the HPFL that we don't know about it. But if we get a complaint, then we know about it and we deal with it. And it becomes part of what we recommend as part of their discipline and or probationary problems that they have to deal with us. And I think that's the best way for me to explain it to you. It serves as both evaluation and monitoring. And sometimes if they think somebody needs intensive inpatient treatment before they go to outpatient, they make those recommendations. Pretty much the $27 that all of the prescribers pay handles most of the cost of the upfront HPFL evaluation. It does not, however, cover the inpatient treatment if they go to one of the psychiatric hospitals in the state or approved psychiatric hospitals outside of the state, because that's an issue relative to insurance and not the HPFL itself in terms of funding. Now, we would like to expand that, quite frankly, to all of our licensees, but the current situation is just the 4 groups that prescribe. And unfortunately, what happens is we have a lot of other licensees that may not have the disposable income or the income period of the prescribing class, and they can't even pay for the initial evaluation to find out if they even need treatment. And so we have a lot of problems with that, and we're trying to be able to, we don't want them to be able not to work, but if we can't get them evaluated, we can't let them go back to work. It's a crazy situation, so we have to do it. So we've been trying for 2 years to get that into the legislature, and every year it seems to be, maybe it's 3 years now, this will be the 3rd year we tried, and it didn't get in, so we're going to really push the issue for next year. I hope that explains it in a manner that you all understand, and I'll be happy to answer any other questions.
I think you answered one of the questions I have, and that is if somebody is self-referred to the foundation does not report that to the board under any circumstance.
We don't know about it until they fall off the wagon, for lack of a better term.
What if somebody goes to the foundation and says, look, I've sexually abused 2 of my patients?
That's a different story. They do not have confidentiality for boundary violations.
Okay, so that's an exception.
Yes.
Okay. Okay.
Do they provide treatment for that?
Yes,
Yes.
they provide treatment, and actually they use several really good places, and one of the places that they like to send people, but it's kind of expensive, is publishing a lot of data now that we're gonna be educating our board on in the next couple of months. I'm hopefully in August, we're gonna have them come down. Apparently, there's a program that they are running out of Kansas that has a remarkable success rate in treating boundary violations. You know, historically, there's the ones that will never violate again. It's a one-time event. They realize they made a mistake. They never do it again. There's the ones that will always violate again. And those are two easy groups to determine. It's that middle group when you don't know whether they'll violate again or not. And that's where these people in Kansas are doing some really interesting work and have some data that's beginning to be very, very clinically based and hopefully maybe make a difference in how we treat these people. But again, they only will, if somebody self-refers that, they come back to us directly.
I think
So-
there's another component that you probably everybody always has to consider, and that is the Tarasoff decision with duty to warn. You know, that where HIPAA, all that kind of stuff doesn't matter anymore. If you are doing an evaluation or if somebody self-refers and during the assessment, there is clear evidence that they could be harmful to others, then yeah, that would breach any kind of concerns regarding confidentiality. You'd have to report it.
So Van, in terms of the foundation, what about situations like bipolar disorder or early, cognitive impairment, perhaps, that sort of thing?
Well, certainly psychiatric disease, we can refer them for the evaluation. They can then send them wherever they think they need to be, make recommendations for therapy, and then when they come from the therapy, then the Director of Investigations reviews what they've recommended and decided is it safe for them to practice. And usually we request, the Investigations Department requests a letter of fitness to practice. And if they're not deemed fit to practice, generally they end up on probation or unable to practice for one reason or another.
And cognitive symptoms and
Likewise, similar thing.
Mhm.
Is the foundation tied exclusively to LSBME? In other words, can it be used by dentists or
Okay, the foundation, we contract with the foundation as an independent contractor. We simply use the services, we pay for it by the $27 you pay every year. They are also, the foundation is doing dentists and veterinarians at this time. The foundation was spun off from the medical society many years ago and functions with an independent board that the medical society can nominate to, but that the board, the foundation can pick from their nominees who they want. But again, right now it is an independent functioning organization that lives and breathes in the corporate structure of Louisiana as separate from the LSMS and the board.
Okay, good, thanks. That's helpful.
And I will tell you that not every state in the union has a HPFL or similar function, but the states that do seem to have better success rates with problems than the ones that don't. There's a nationwide movement to get every state to get ones for its licensees, but again, some boards do it, some boards don't.
To me, there's an advantage of having it in the sense that you sort of remove any bias that might exist within the Committee on Investigations. I know we like to say we don't have a bias, but we all have biases, and I just like the idea of that. I hear lots of problems about the psychology board and the way they do investigations. And it would seem to me that if they had something like the foundation, they would be a lot better off.
Well, and again, we have to, I have to fess up. We've had a lot of problems with investigations. And in the last 18, well, almost 20 months now, I have to say that our people have really revamped the workflow, the processes, the timeliness. And, 24 months ago, we had 800 open investigations and some terrible things about that. And then right now, we only have 155, 56 open investigations. We've trimmed down the workload. We've increased the velocity with which we resolve these cases. And a lot of that is based upon some really good work done by the department, but also was stimulated by some information that we gained from a large look at what I can only describe as physician mortality related to investigations. And we were accused in 2018 of causing people to commit suicide. And the data really does not support the fact that investigations causes suicide, but it does. It is highly associated with and appears to cause health problems. And so we have really worked to shorten the time of investigation to get people resolved so that they're not sitting out there anxious about what the result's going to be, getting it resolved so that they can know how to move on with their life. And I think that's been a great boon. And I have to really really be honest and say, show a great deal of gratitude to the new director of investigations, Dr. Francis, and his staff. They've done a remarkable job to close the gap on all these open investigations.
Thanks. Next item on the agenda is just the status of our rule change regarding the legislation that was passed in 2024 regarding the nurse practitioners and the physician assistants. Do we know where that stands?
Lauren?
Yeah, that is currently still with AG's office. So it got sent up there around the end of April and it's still in review. So I think because of session and everything, it's just taking a little while.
So after they review it, what happens, Lauren?
We've sent it to the legislature, and then if they approve it and they don't have any changes and they haven't gotten any public comment that we need to address, we can move on with final promulgation. And so just publishing the rule back in the register. So we're towards the end.
Does the legislative review accept comments?
If they have an oversight hearing, but they haven't requested that. The AG's office review has a public comment period.
Still no word from months ago.
Just now.
Okay.
Approximately 8 minutes.
All right, so we'll have to do another rule change for the recent legislative change regarding the licenses.
Yeah, we can address that after these are done.
Okay. Our next meeting date is scheduled for July, and we don't have anybody in the queue, as I said. Maybe I said that before the meeting started. So I'm proposing right now that we skip the scheduled meeting in July and we'll meet again at the scheduled date in September. Obviously, if something comes up and we need to have a meeting about something or other, we'll notify everybody and try to find a date. But it seems sort of quiet right now. So
you're optimistic, Dr. Lowe.
I know. Have you ever had a quiet day, Van?
I feel like a fireman when I work in this place some days.
There's one thing that I intended to put on the agenda and omitted, and that has to do with psychologists in the military, medical psychologists in the military. I'll put that on the next um, agenda. It's something we need to think about. Um, I think we're going to have to do, if we decide that we're going to continue to license MPs in the military, I think we're going to have to make a change to the law and to the rule, because the only reference to that now has to do with their exclusion. They're allowed to do the things that they're trained to do as long as they practice within the confines of the military setting in which they are assigned. So really, we have nothing that allows us right now to accept applications from the military psychologists, although we've done it. And I think it was done initially sort of in good faith and as a nod to people who are serving our country, that we would want to make it available to them to become a medical psychologist. But I think we're going to have to make a change to the law. So just be thinking about that. We'll talk about it more at our next meeting. Okay, I think we're ready to go to executive session. Is there a motion or?
Question, at that next meeting, when we discuss that, can we get some kind of numbers as to how many people have done this? Like how many are practicing in the military, to give us kind of an idea how prevalent this is? For the
Yeah,
next,
I'll see if Matthew can give us a number on that. Maybe you can. We've had a couple, just recently. In fact, we've got one today. So, okay. So, can we go into executive session?
Move that we go into executive session.
second,
All right. Can you switch that up for us?
Yep, the groove will get it going. Click the join button.
Okay, so we join room 1. Okay, back in regular session. Do we have a motion regarding the application we reviewed?
Yes, I would move that the board recommend approval of both applicants to the licensing board.
Second.
All in favor?
Aye.
Aye.
All right. Any other business that we have? Any public comments, Van?
Let me take a quick check. 1 second. I apologize. No public comments.
All right. Anybody have any comments, questions they want to bring up?
I just want to wish everybody a happy 250th birthday.
Yeah,
We
absolutely.
won't be getting together before the 4th of July. And
Absolutely.
I really pray that everybody stays safe during all
healthy.
these
Thank you.
celebrations.
Thank
Thank
you.
you.
Yeah, thank
Thank
you.
you,
Happy
Robert.
Father's Day to everyone too.
Yeah.
Thank you.
All right, motion to
Appreciate all the
adjourn.
time you give to this effort.
Thank you.
You too, Van. Thanks.
Thanks, Van.
Motion to adjourn.
Second.
Agreed.
All right.
Agreed.
Thanks, everyone. Appreciate it.
Yeah.
Thanks.